feel like this is not gonna be that great lighting, but sometimes you've just got to do what you got to do. Hi guys, it's Tani and welcome back to my channel. Straight up, I'm just gonna be honest, my life is just absolutely crazy right now, which I say this at the start of every single video. Let me know down below, would you rather me keep uploading videos like this, which are a bit more kind of spur of the moment? I'll be honest, they're not as like organized, but if I'm completely honest with you, I just don't have time to dedicate as much as I used to. Just let me know if you're happy with me just kind of trying to give you as much information as possible when I can, or if you would prefer it to be more structured. They'll probably just have to be a little bit more spread out because I'll need to put more time and effort into organizing them. Today I really wanted to debrief about my basic OSCE that I have just completed. In Australia, I don't know if it's just New South Wales, but I assume it's all of Australia. When you're doing your enrolled nurse diploma, you have to do a simulation exam called your basic OSCE. So what I wanted to do today is just kind of run through what to expect and what happened for my simulation, and just give you guys a few tips because it is something that's really hard, well, I found really hard to prepare for because you don't know what to expect really. Normally you complete your basic OSCE within the first few months of studying. Mine was delayed a little bit because we actually got a placement, so that kind of pushed back everything a little bit in the course, which was a good thing because as soon as placements come, you should be taking them. Also, I really love when you guys all DM me on Instagram. It's actually so nice. I just had someone message me and say that they got accepted. Oh, I'm so happy for her. So yeah, I had my basic OSCE a little over a week ago. As I was saying, it's a simulation test. So what happened in my institution was we got partnered up just by alphabetical order. So I was with the girl in my class. We got allocated a time slot throughout the day and the whole process takes about an hour. So you're the only ones in the room. So it's you two and the teacher. So first up, I was the patient and another person in my class was the nurse. We were both given a scenario sheet. So I was given the patient scenario and she was given the nurse scenario. So you do get a little bit of background knowledge on the patient. For example, you're given the observations as well as why they have been admitted. So you're not having to walk in guessing what's happened to the person. I was the patient first and then we switched over. I guess what you want to think about with your OSCE is approaching it as if you're in the hospital. So you want to be doing your hand hygiene as soon as you walk into the room. So just get some hand sanitizer, do your hand hygiene, walk in, introduce yourself to the patient. I found this really difficult because I just felt stupid because I wasn't in the hospital and it's not a real patient. But before I started, I just said to myself, pretend you're in the hospital. You don't need to care what other people think of you. The teacher would rather you take this seriously. So I just went in with a clear mind of, I'm in the hospital, I'm this patient's nurse, and I'm going to treat her as if we were out in the field. So I walked in, did my hand hygiene, introduced myself to the patient, and you just do those normal things like getting them to confirm their name and their date of birth. And yeah, that's kind of all the simple stuff that is fairly straightforward. The main part of the basic OSCE is doing an admission form. Now, what I would say with the admission form is don't focus on getting that out of the way. I would actually first come in and talk to the patient and just say, how are you feeling? Is there anything that I can help you with? Are you in any pain at the moment? And you want to do that because you need to be able to identify if your patient has any immediate concerns. So for example, I can't even remember my scenario now, but I do remember that my patient was in quite a lot of pain. So as soon as you hear pain, you're wanting to do that pain assessment. So asking how the pain started, like what they were doing, can you describe the pain? Is it continuous? Does anything relieve the pain? And do a pain scale. After doing that, I realized my patient was in a significant amount of pain. Now, what a lot of people do here is they go, okay, we'll get that looked at. Let's continue with the admission form. But when someone's in pain, you want to treat that as soon as possible. The admission form can wait. Treat your teacher as the registered nurse. What I did is I went to my patient and said, okay, I really want to get that looked at so you can feel comfortable. Let me go and consult the RN and I'll see if there's anything we can administrate for you. So I went, talked to my teacher or the RN, explained the situation, asked if I could get any pain relief, to which she said, yes, let's administer such and such, and that's going to help your patient. That's the one thing you want to remember is don't leave a patient uncomfortable. Even when I was the patient and my friend was the nurse, in my scenario, I was really nauseous. So what she had to do is make sure she grabbed a vomit bag, which we have available in our facilities, or say, I'm going to go and see if I can get some anti-nausea medication, or I'm just going to go get a plastic bag or something in case you feel like you need to throw up. Make sure you treat those concerns as they come. Don't continue with the admission form if there's a concern. So yeah, after I'd done that, I continued just ticking through the boxes. The admission form is super easy. It's very straightforward. You're just asking the patient a few different questions. Some of the questions might be, does the patient understand English? A lot of these questions you don't have to ask. So if you're having a conversation with your patient and they're responding in English, then yes, they do understand English. You don't need to actually verbally ask that question. And that's another thing that they'll be testing you on, is to see if you've got that common sense and understanding of the situation. Yeah, I would just practice doing a few different admission forms that are available online, just to familiarize yourself with all the different questions that can sometimes be on them. Another one that people struggle with is whether they, like when the patients last opened their bowels or when they've last gone to the bathroom. And with those types of questions, you just have to learn to be comfortable with them. And I think it's just fake it till you make it. Just be confident. If you're uncomfortable, people can hear it in your voice. Just try and be as confident as you can. So yeah, I just continued on with the admission form, finished that was no problems. And then you have to do a patient handover to the RN, that's your teacher. With handover, you want to follow the ISBA or ISBA, what's it called? Like abbreviation thing. You guys should probably know what I'm talking about. Yeah, I just went through the steps on ISBA and did my handover. Be professional. Don't treat them like your teacher. Treat them like they're a registered nurse in the hospital. So that whole kind of process, I think you get 20 minutes to do the scenario. In the scenario, you also get to ask as many questions as you would like. So you want to get as much information about the patient as possible. Oh, another thing I didn't mention was my patient did have low oxygen saturation. So my patient was at 92%. So that was another thing that I made sure to act on quite quickly. So yeah, you want to do things like deep breathing exercises, getting them just to kind of move their feet around to increase blood flow around the body. You don't actually need to do any observations in your basic OSCAR. So yeah, you get about 20 minutes for your scenario, which most people don't use the whole time. I think you'll probably use about 8 minutes, to be honest. Then you're going to hand over. And then you get another 20 minutes to do all the written components. So your written component of your basic OSCAR is doing progress notes, doing your SAGO charts, and doing a patient care plan. I found all of it pretty easy. I think the hardest part was probably just doing, I found it straightforward doing the care plan, but that's what a lot of people in my class particularly struggled with. And I get it, is because we don't touch on it much. So you have to, well, in my case, we had to list 2 actual problems and 2 potential problems. So actual problems are things that are happening right now. Let's say your patient had like lacerations down their arm. That's an actual problem. Or if they've got high blood pressure, that's an actual problem. A potential problem would be risk of infection to lacerations in the arm. Another potential problem is let's say your patient is an elderly man who lives alone, has had a fall and can't go to the grocery store anymore. That's a potential problem. Him not being able to get to the grocery store means he can't get food, he can't cook for himself. So you're going to say, I would get in contact with community services or like Meals on Wheels, for example, to organize him to be looked after. So you really want to start thinking outside the box and not just focusing on the immediate problems, but potential problems as well. We had 20 minutes to do the progress notes, the SAGO chart. So SAGO chart, most of you would probably know, is just the observation chart. So you'll get given the observations, you've just got to make sure that you're charting them correctly. Another thing to make sure you do is make sure you write the patient name and MRN on every single page. But to be honest, I actually think it's such an effective way to learn. I was very nervous, but I think a lot of us were nervous because it's not a normal day at TAFE anymore. It's scheduled times. It kind of reminded me of the HSC, which I think is what gave it that daunting feeling. But it's literally just split up like that so that the teacher can evaluate everyone. Another thing too, in the scenario part, the teacher will prompt you if you're missing steps or if you're forgetting something. So keep in mind, you don't want to be prompted. You don't want the teacher to have to tell you, oh, maybe you should check their observations, or maybe you should get some pain relief for this patient then if they're in pain. They will guide you, and don't be put off if they do have to prompt you a few times. Just don't rely on the teacher to do that. And yeah, have fun with it, because I actually, looking back now, I actually really enjoyed it. It's just because I was so stressed and anxious the morning of, I really struggled. But yeah, you learn so much from it. But that gives you guys a bit of a gist of what to expect. As always, please just comment down below if there's anything else that I can help you with. Please let me know about what I said at the start of the video, if you like these kind of videos, or if you would prefer me to spend a bit more time on organizing them. It'll just mean that they won't get uploaded as frequently, and they're already not as frequent. So, but hopefully in the holidays I'll have more time to upload. Yeah, as always, I hope you guys are all doing super well. Please like this video if you have enjoyed it, and also subscribe if you aren't already, and I'll see you in my next video. Bye.